welcome everyone to the People's House.
Mr. Speaker, will you please call the House to order?
The bill is passed.
And that's why I think that this legislation is an opportunity for us in this House
Hello and welcome to this edition of Assembly Update. I'm Assemblyman Robin Schimminger. Now, usually on these shows I sit as the interviewee. Today I'm sitting as the interviewer. And I have two wonderful guests. These guests are from the Olmsted Center for Sight in Buffalo, an organization formerly called the Western New York Blind Association. And it's a very auspicious time that they're here in Albany. Just yesterday in the Hall of the Governors in our state capitol, there was a new portrait unveiled. As we know, in the Hall of the Governors, there is a portrait of every governor of New York State. But for the first time now, as of yesterday, the only blind governor of New York State, David Paterson, who was legally blind, was unveiled. And so it's very special that today we have here two representatives from the Olmsted Center for Sight in Buffalo. One of them, who I think I'll turn to first, is the President and Chief Executive Officer, Tamara Owen. You can remember her name because her initials are T.O., just like Terrell Owens. And the other is an assistant a trainer at the center, Ray Zylinski. These two individuals have come all the way to our state capitol to transact some business and also for the opportunity to be with you today here in television land. So, Tammy, first of all, welcome to the show. Nice to have you here. You have been the president and CEO just for a relatively short time now.
Mm-hmm. Yes, I joined the Olmsted in April of last year, so it's been less than a year. After a 23-year career in healthcare, where we had the opportunity to have a lot of interaction. But it's been a great transition for me, and one where I really am able to use all that I learned and the individuals that I got to know within the hospital systems.
Not to dwell on the past, but of course you were for a good period of time the leader at the DeGraff Hospital, the hospital that I was born in.
Yes, that pristine hospital, yes.
That's where we first got to know each other
is.
best. Then you went on to other things as well. And we're also joined by Ray Zylinski. Ray, can you tell us just in a nutshell what you do there at the center?
Sure. Basically, I'm an assistant AT instructor. AT stands for Assistive Technology, and I sit in the classroom with the students at the Statler Center and assist them with the curriculum, help them get through basic classroom course material, as well as, assist them in getting ready for the workforce. I also am a customer service representative in the 211 call center. We call INR specialists, information and referral specialists, and I've been involved with the various different campaigns there since October.
Excellent. It sounds like there are a lot of things going on, Tammy, at the Olmsted Center. Mm-hmm. Tell us a little bit about the various activities at the Olmsted Center.
Sure.
Where's it located, first of all?
We're
we know that.
Down on Main Street, right on the edge of the medical campus. So mm-hmm. It's a great place to be. It's very busy. We're really a full-service organization. We deal with individuals from birth through the elderly that have visual impairments. And our main focus is to just try to make people as independent as possible that have a visual impairment. And that includes everything from preschool with toddlers and helping prepare them to be mainstreamed through school, all the way through education programs. We work with individuals in the public school system on orientation mobility training, living independently in a world without sight. And we run an education program that Ray spoke of, the Statler program, which is a career training program for careers in hospitality or contact center services. We also have housing units that are not just for individuals with visual impairments, but also those with physical impairments, and they're located all over the 8 counties of Western New York.
We've got one in North Tonawanda,
Yep.
I know. I think
Yep.
there's one in Riverside.
Yep, one in Lockport, one in Cheektowaga.
Maybe another one in the pipeline,
yes,
too.
Yes, there is. Yes.
Now, how do people access the Olmsted Center? How do they get in to receive the services?
Okay.
What do they have to be,
Yeah.
first of all?
Well, great question.
Okay.
There really are two categories of vision
Yeah.
loss, the legally blind and those with low vision. So, we all know normal vision is 20/20. Legally blind is 2200. And you lose your ability to drive at 20/70. So there's a big, and then there's complete blindness. So those that are 2200 have some vision, and visual loss comes in all sorts of different ways. Some lose just the central portion of their vision, some lose peripheral vision, and as I said, some are born without vision, and some lose it later on in life due to some type of pathology. Those that are legally blind, so if their doctor has deemed them legally blind, they can access the Commission for the Blind, and then they get sent to Olmsted, so they can just call our Main Street office phone number and get an appointment with us. Everybody that comes in sees our low vision specialist, and his role is really to maximize any residual vision that you may have left. To allow you to watch television, and as Ray stated, one of his roles is to teach people to use the assistive technology that's available for low vision individuals. So again, if you're legally blind, you would access through the Commission for the Blind, and they pay for the services that you receive, at least a portion of them. If you are not legally blind, then as well, you just call us and we can set up an appointment with you. But those services are covered in part through your just private health insurance. Really, all they cover is an eye exam, and then any type of adaptive equipment or technology that you use. It is not anything that is covered through insurance, but people pay privately for, whether they're magnifiers or computers, and just like computers that you and I would purchase, but they have special technology that make them useful for those that are visually impaired.
So those are a couple of examples, special computers and so on. Ray, what are some types of assistive technology that you train people on?
Well, specifically, I deal with a program called JAWS. That's an acronym, Job Access with Speech. And ironically, it's opened up the door for visually impaired people, really, to move them forward from, sheltered workshops and basic assembly work to being able to, operate a telephone, become an outstanding customer service representative behind the phone, work in a hotel, work in various different aspects of the workforce where work just wasn't available. Because the technology wasn't there. They weren't able to perform all aspects of the job. So, JAWS is a big one, and it's a talking software. It speaks to someone who either, like Tammy is saying, has next to no vision at all, or zero vision like myself. And, they are able to fully access the internet and, Microsoft Office and various different programs that you'd use in the workforce. And then there's also screen enlargement software called Zoom Text. And those are just two of the mainstream. I mean, there's a lot of different screen reading softwares out there, but those are the ones that we use in the center. And Zoom Text allows the text to be enlarged to different color contrasts for the screen, for different visual acuities to recognize different things, and cursor adjustment as well, so you could see, what you're pointing and where.
Now, Ray, I guess this is a Tammy question, but Ray got me thinking. Ray mentioned early on in the show 211, so apparently the Olmsted Center has some kind of a relationship with the 211 system. Can you explain that relationship?
Sure. 211 is a Health and Human Services phone service.
Other than 911, it's
Correct.
211.
Correct. So any kind of social service that anyone is in need of, from housing to food to shelter to employment to tax preparation, you call 211, and the individuals will answer the phone and answer your questions and direct you to the right agency. That used to be, it's a program that was run through the United Way, and the United Way actually moved the program over to the Olmsted Center. So it's actually run right out of our Main Street office, and it's a great line of work for individuals with visual impairments. As Ray said, they have full access to the computer database of 3,000 agencies. So they have a microphone on their head, and they're listening to the caller in one ear, and as they're navigating on the computer, the computer is actually talking in their other ear. So at any given time, they're getting input into 2 ears of different things, and then they speak back with the caller, directing them to the service that they're looking for. So it's really been a great partnership to continue to be able to provide this great service to the community and also give individuals that are visually impaired outstanding work.
Great. So in contract with or on behalf of United Way, you run the 211 program. Now, are all of the people that staff it
Visually impaired?
visually impaired?
Not all of them. Initially, when the program rolled over, it was a private agency, and those individuals were not visually impaired, so their employment has been maintained. As we add more individuals that we train in contact center services, they are adding to that staff. So not everyone is visually impaired, but over time, that would be something that we aim to do. Like we run the switchboard at our local VA hospital in Buffalo,
Right.
as well as the one in Erie. Both of those hospitals, I think there's 12 individuals at each site that are fully blind that run the entire switchboard operation of those two facilities.
And the switchboard is operated out of the Olmsted building, or it's operated at the VA hospital
At the
itself?
VA hospital.
At the VA itself.
Yep. So
And
they
in
sit
Erie.
right in Erie and here in Buffalo, they sit right in the hospital, just like the other hospitals have call centers, and they manage the entire phone operation of those organizations.
The Olmsted Center also runs the Statler Center.
That's correct.
Tell us about the Statler Center.
The Statler Center was a partnership that started in the late 90s with our Statler Foundation, the large hotel foundation. And it was created to create an educational opportunity to train blind and visually impaired for jobs in hospitality services.
And Ray kind of interdigitates with the
Yes.
Statler Center as well.
Yep.
Yeah.
Yes.
So we have individuals from all over the United States, and we've had some international students come to Buffalo for 10 weeks and go through the curriculum. They stay at the Holiday Inn, who's a great partner of ours.
Holiday Inn?
Yeah, and they not only are they learning the skills to go out and get those jobs, but they're also learning the discipline of showing up to school. We set it up just like a day at work. So they have to be there at 8 o'clock. If they're not there, if they're 30 seconds late, then they do that 3 times, they're sent home. They have a 15-minute break, so it really set it up like the day of work. So we, through that program, are training individuals in those 2 curriculums, and we also go out and source jobs and actually work on the placement of those individuals and work with the employer to get the person, on site and started. And as Ray described, the computer software, that's a lot of what we do, is we'll go out to a company and make sure that their software is accessible to the technology. If it isn't, we have ways to make it accessible, and then really start and get the employee started. But it's really been a great partnership. We've trained over 500 individuals in that program, and the average employment rate for individuals that are blind or visually impaired is only 35% of those that are eligible for work have jobs. Our Statler program, we have placed 82% of our graduates
That's great.
in meaningful employment.
That's great. That's great. This has been wonderful. Thanks very much, Tammy Owens. Thanks very much, Ray Zylinski.
Thank you.
This has been
Thank you,
Assembly
Robin.
Update. I'm Assemblyman Robin Schimminger. Thank you for watching. Take care.